This is an excellent, excellent question for USMLE. Students get this wrong. Hence, you're going to learn this factoid. You get it right. You get an extra point on your USMLE. Everyone's fucking happy. You get into the residency of your choice. You live life happily ever after, all because you saw this one question about a ring enhancing lesion and you got extra excited about it. Okay? That's my extended intro. That's my improvisation. Why don't we actually get into the fucking question, okay? So literally, we have like a one line question. 42-year-old woman with SLE has a ring enhancing lesion. What's the diagnosis? So this is a favorite USMLE question, all right? I'm going to walk through these answer choices. Amyloid angiopathy, wrong fucking answer. That's the answer for Alzheimer. So obviously you're going to get amyloid plaques. You can get blood vessel formation within those plaques, and you can get recurrent hemorrhagic stroke in patient with Alzheimer. Answer, amyloid angiopathy. Not the case here. Choice B, lymphoma. This refers to primary CNS lymphoma. This is the correct answer. And the reason it's the correct answer is because this patient has an autoimmune disease. And your factoid is that autoimmune diseases are associated with increased risk of CNS lymphoma, okay? Particularly SLE, Hashimoto, dermatomyositis, okay? So autoimmune disease, increased risk of lymphoma, notably CNS lymphoma, and also immunodeficiencies, increased risk of CNS lymphoma. So HIV, AIDS, okay, especially when your CD4 count drops below 50, USMLE likes to give you primary CNS lymphoma as well. The reason this is a little bit challenging, this question, is because we literally explicate, we literally write ring enhancing lesion. Students are like, oh, wow, ring enhancing lesion, that's toxo. It's not fucking toxo, okay? We can by all means say cats. We can by all means say she consumed pork. That's a tangential USMLE point that if they don't tell you anything about cats, that the way people can acquire toxo is through consumption of pork. That's on one of the retired step 1 NBME forms. So it's not toxo, all right? Now, metastatic disease can present with ring-enhancing lesions, usually multiple, 2 or more lesions. Not mandatory, but usually the case. And there's nothing described about cancer in this patient. It's not that it's impossible, it's just primary CNS lymphoma, most likely in the setting of autoimmune disease. But we would have multiple ring-enhancing lesions at the gray-white junction. That's the classic description for metastatic disease. Choice D, neurocysticercosis, wrong fucking answer. That's going to be tinea solium, which is pork tapeworm, usually associated with travel to Mexico, going abroad, can cause a Swiss cheese-like appearance to the brain where you have lesions everywhere. Or they can just show you what looks like a cystic structure, classically within one of the lateral ventricles. That's neurocysticercosis. Treat with praziquantel, an anti-Helminth agent. Saccular aneurysms of the ACOM, anterior communicating artery, posterior communicating artery. Wrong answers. Okay, so classically saccular aneurysms with hypertension, most common cause, but more specific causes like Ehlers-Danlos syndrome, polycystic kidney disease. ACOM aneurysms are more common than PCOM aneurysms. If the USMLE gives you a PCOM aneurysm, they're often going to give you an ipsilateral blown pupil. That's high yield, all right? So a posterior communicating artery aneurysm can cause an ipsilateral mydriasis, an ipsilateral blown pupil. And that's pretty much it for this question. I'm not going to make this 37 minutes. We can do lots of chat, but your take-home point literally is just autoimmune disease, immunodeficiency, increased risk of lymphoma, notably CNS lymphoma. Don't instantaneously jump on toxo just because they say ring-enhancing lesion. Ring-enhancing lesions can be malignancy. They can be abscesses, okay? So that's it. If you liked this, subscribe to my channel, and I appreciate your time. That's it.